Hypertension, commonly known as high blood pressure, is one of the most widespread health conditions globally. It silently affects millions of people, often without noticeable symptoms, making it a major contributor to serious health complications like heart disease, stroke, and kidney failure. Blood pressure is the force exerted by blood against the walls of the arteries as the heart pumps it around the body. When this pressure stays consistently high, it can damage the blood vessels and vital organs over time. In a healthy individual, normal blood pressure is typically around 120/80ths of a millimeter of mercury. The top number represents the systolic pressure, which occurs when the heart contracts and pumps blood. The bottom number is the diastolic pressure, indicating the pressure when the heart is at rest between beats. Hypertension is usually diagnosed when the blood pressure readings consistently exceed 130/80ths of a millimeter of mercury over time. This condition doesn't develop overnight. It is the result of various factors that gradually impact the heart and vascular system. There are many reasons why someone may develop hypertension. Genetics can play a significant role, especially if there is a family history of high blood pressure. Age is another contributing factor. Blood pressure naturally rises as we get older due to the stiffening of arteries. Lifestyle choices, however, are the most common and controllable causes. A diet high in salt, saturated fats, and processed foods can elevate blood pressure levels. Consuming excess sodium causes the body to retain water, which increases the volume of blood and thus raises blood pressure. Obesity is also strongly linked to hypertension. Extra body weight means more blood is needed to supply oxygen and nutrients to tissues, which increases the pressure on artery walls. Physical inactivity worsens this problem. When you don't exercise regularly, your heart becomes less efficient at pumping blood, and over time this can lead to increased pressure on the arteries. Smoking and excessive alcohol intake are also major contributors. Nicotine from cigarettes raises blood pressure immediately and damages the lining of the arteries. Alcohol, when consumed in large amounts, interferes with blood flow and hormone balance, increasing the risk. Stress is another factor that is often overlooked. While stress itself may not directly cause long-term hypertension, the coping mechanisms people use, such as smoking, drinking, or eating unhealthy foods, can significantly impact blood pressure. Chronic stress can also affect hormonal levels in the body, which in turn can influence blood vessel function. While hypertension can often go unnoticed for years, it can eventually lead to very noticeable and dangerous symptoms. These may include headaches, shortness of breath, chest pain, dizziness, vision problems, or even nosebleeds. However, many people live with high blood pressure for a long time without any symptoms, which is why it's often called the silent killer. The good news is that hypertension can be managed and even prevented in many cases. Conventional medical treatments often involve lifestyle modifications combined with medications prescribed by a healthcare provider. These medications may include diuretics, which help the body eliminate excess sodium and water, beta blockers, which reduce the heart rate and output of blood, ACE inhibitors, which help relax blood vessels, and calcium channel blockers, which prevent calcium from entering the heart and blood vessel cells. However, medication alone is rarely enough. Making significant changes to your daily habits is essential for controlling hypertension in the long term. One of the most important lifestyle changes you can make is improving your diet. The DASH diet, which stands for Dietary Approaches to Stop Hypertension, is specifically designed to help people lower their blood pressure. It emphasizes fruits, vegetables, whole grains, lean proteins, and low-fat dairy products, while reducing salt, red meat, and added sugars. Potassium-rich foods such as bananas, sweet potatoes, spinach, and avocados can help counteract the effects of sodium and lower blood pressure naturally. Maintaining a healthy weight is another crucial element. Even a small amount of weight loss can have a significant effect on lowering blood pressure. Combining healthy eating with regular physical activity, such as brisk walking, swimming, cycling, or strength training, can significantly improve cardiovascular health. Ideally, aim for at least 30 minutes of moderate intensity exercise most days of the week. This not only helps with weight control but also improves heart function and reduces stress. Natural remedies can also support your blood pressure goals. Garlic, for example, has been shown to relax blood vessels and improve circulation. You can consume fresh garlic, aged garlic supplements, or incorporate it into your cooking. Hibiscus tea is another natural option. This herbal tea contains antioxidants and compounds that act as natural ACE inhibitors, helping to lower blood pressure. Omega-3 fatty acids, found in fatty fish like salmon and mackerel, have been linked to reduced blood pressure and improved heart health. If you don't consume fish regularly, omega-3 supplements can be an alternative. Limiting caffeine can also help. While the long-term effects of caffeine on blood pressure are still debated, it is known to cause a temporary spike in blood pressure in some individuals. If you are sensitive to caffeine, it may be wise to monitor your intake and switch to alternatives like herbal teas or decaffeinated coffee. Reducing alcohol consumption is another powerful way to lower your blood pressure. Men should limit themselves to no more than 2 drinks per day and women to 1 drink per day, if at all. Stress management is equally important in the fight against hypertension. Practices like meditation, deep breathing, yoga, and mindfulness can calm the nervous system and reduce the body's stress response. Establishing a healthy sleep routine is also essential. Poor sleep or sleep disorders like sleep apnea can raise blood pressure over time. Aim for 7 to 9 hours of quality sleep each night, and create a relaxing bedtime routine to improve your sleep quality. Self-care also means staying informed and monitoring your progress. Home blood pressure monitors are widely available and easy to use, allowing you to track your numbers regularly. Keeping a log can help you and your healthcare provider identify trends and make necessary adjustments to your treatment plan. Make regular visits to your doctor to assess your cardiovascular risk and adjust medications or recommendations as needed. Quitting smoking is one of the most impactful steps you can take for your heart health. The effects of smoking on blood pressure are immediate and cumulative. Within weeks of quitting, your blood circulation improves and your blood pressure begins to decrease. Support programs, nicotine replacement therapies, and professional counseling can all increase your chances of success. Hydration is often overlooked but plays a critical role in blood pressure regulation. Drinking enough water helps the kidneys flush out excess sodium and toxins, maintaining a healthy blood volume and pressure. Aim for at least 8 glasses of water per day, more if you are active or live in a hot climate. Avoiding processed foods is vital. These often contain hidden sodium and unhealthy fats that can raise your blood pressure without you realizing it. Reading food labels, cooking more meals at home, and choosing whole, unprocessed foods can dramatically improve your health outcomes. Fiber-rich foods like oats, legumes, and fruits not only improve digestion but also help in managing blood pressure levels. It's also helpful to manage other underlying conditions that may be contributing to hypertension. Diabetes, high cholesterol, and thyroid disorders can all affect your blood pressure. Managing these conditions through medication, lifestyle changes, and regular checkups is essential to maintaining overall cardiovascular health. Incorporating natural supplements like magnesium, coenzyme Q10, and L-arginine may offer additional support for those managing high blood pressure. Always consult your doctor before starting any supplements, especially if you are already taking prescribed medications. Personalized approaches are often the most effective. Creating a calm, supportive environment can make a big difference in how you manage stress and stick to your health goals. Surrounding yourself with people who support your journey, joining a fitness group or health community, and engaging in hobbies that bring you joy can enhance your emotional and physical well-being. In summary, hypertension is a manageable condition when approached with awareness, consistency, and care. It requires a holistic commitment to healthy eating, regular physical activity, stress management, and medical oversight. Natural remedies and self-care strategies can support the process and lead to lasting improvements. By understanding your body, making informed choices, and taking proactive steps, you can control your blood pressure and protect your heart for years to come.